So let's talk about recognition. So in the States, when I started in the 90s, this map was blue with 10% obesity, and it's now become, and I'm not going to show China or Hong Kong, we've heard about those earlier, but now it's red and purple. I'm very impressed with the purple states that have more than 35% obesity. Though in Australia we're not doing as well as we should, because our latest figures show 2/3 of us are overweight and obese, and 28% obese. And despite everything, the overweight people are becoming obese. So we're shifting further and heavier. And who is it that is gaining weight? Not me. Not me, because look at me, I'm pretty good up here. Right? It's this mob down here, and it's something that women do better than men as well. It's another thing they do better than men. So where do we treat obesity and think about obesity? We think of it up here when people have got a disease, a complication, and really we should be thinking about obesity and recognising it down here in the younger people. And I show this because this is from our Premier's priority, which is on childhood obesity. Most babies in Australia are born of normal weight, normal size. By the time they're 3, over 20% of them have a weight problem. And the other time when people gain weight, which I've just shown you, is in this young adulthood, right? And we tend to be thinking about obesity out here rather than putting in programs for children and for young adults to prevent obesity. What about the cost of obesity? And again, I apologise for this slide, but it's just a recent effort by us. And these are the direct costs, 3.8 billion in Australia per year. And with the indirect costs, and the government got really upset with this, foregone tax, $3.4 billion a year. So a total cost of 8.6 billion Australian dollars a year of obesity. And that's conservative rather than us trying to inflate it, right? And the other thing that's really important is, which we forget, is this. This is a UK study, and as the BMI goes up, the cost per patient of prescribing drugs goes up. And just shifting people down reduces the cost of drugs for the health system. So if you can get people to lose weight and show that there's a reduction in drugs, you can show a cost benefit. Not so much in children. Now, is obesity a disease? Well, this was in 2009, and they came out and said obesity is a chronic condition or disease with serious implications for life expectancy. And if you're in a Caucasian, BMI more than 30, reduced life expectancy of approximately 3 years, and more than 40, 8 to 10 years reduced. And for each 5 kilograms, each chunk, there's a 40% higher mortality rate. So we're starting to get it out there that obesity is a chronic condition or disease, right? And it is, I think, having worked in this area for many years. It's a major problem now and becoming worse. It needs medical management or proper clinical management, and that management is similar to many of what we accept as chronic diseases. We heard about heart failure, we know about diabetes, cardiovascular disease generally, renal disease. This is all underpinned by what we would call these lifestyle interventions plus something specialised, a drug or a whatever. And obesity is the same. So it's the same components, same staff involved. And like every other disease, once you've got it, it doesn't go away. It's a chronic relapsing condition. That's why we don't do so well when we think about long-term sustained weight loss, because this is a chronic relapsing condition. It comes back and it's lifelong. And various learned associations have said that obesity is a disease and published on it. And this is becoming more and more. And the Obesity Society in America just produced its updated 2018 version of this. And why should it be thought of as a disease or a chronic condition, a chronic relapsing condition? You can use whatever. Disease is simpler, one word. Why? Why is that important? Because if we don't think of it that way, we don't provide the appropriate obesity management and prevention. Right?